right, hello. I'm Dr. Hales.
I'm Dr. Lincoln Parker.
Lincoln Parker. And today we're gonna talk about cosmetics, especially teeth, because that's kind of what we do.
Yeah.
So, not so much facial plastic surgeon. You gotta go somewhere else for that.
Yeah.
But
right.
maybe future, maybe get
Sure. Yeah.
So
just get a little medical degree along with a dental degree, and
you never know.
I got time. I can do that.
So, Lincoln, tell us, someone comes in, a patient comes in, right? And they say, I don't like my smile.
Yeah.
So what can you do to change that, to give them something that they like?
Well, that's by far one of the most fun things we do, right? I can't tell you how excited our team gets when we are able to change someone's smile and do that reveal for them. That's everybody gets buzzed in the office when we're doing that, which thankfully we get to do a lot of that here. We get to affect a lot of people's smiles out here through a lot of different ways. And it can be so profound and such a big change. I mean, every day of that person's life can be different. When you're talking, smiling, when you're eating, that type of thing. So there's a lot of different ways we can do that, right? We can shift teeth into different position through clear aligners like Invisalign. We can utilize composite filling material and do some bonding. We could do even just simple contouring, right? We can do some contouring on the edges of teeth to change their shape or maybe a little direction here or there, and that can provide some improvements. And then of course everyone's heard of veneers, which is the ideal treatment in the ideal scenario, right? Not everybody needs veneers for a smile improvement, but if you're going to get the best improvement and the most ideal, the most controlled, where you can change color, shape, bite, you can change so many things very quickly with veneers. And so one of the more challenging things to do well for somebody is to create some natural looking veneers, but also one of the most rewarding for sure.
Yeah. And so some people they don't know exactly what a veneer is.
Yeah.
Can you give some explanation of what veneer is and how does it work? Is it just 2, 4? What do you usually see with that?
Yeah, so a veneer, the basic definition is an additive layer, right? So you can veneer wood and you can veneer a lot of different things. So the basic definition of it is additional material onto your tooth to create a different finish. So that can mean a lot of different things. Some patients, they may only need the additive, right? You don't need to change their teeth so much, they just need the additive on top. And you can create a beautiful smile with that. Some people will need some changing of the tooth underlying before you put the veneer on top to create a nice smile, right? To follow the lip, to follow the corridor down the sides, to create that presentation that they want to see. But really it's dictated by the patient, and so this comes down to communication. So doctor and patient, doctor and his team. And so sitting down and taking the time to assess, okay, well, what bothers you? What do you want to see as far as changes? What are your hopes and dreams for this change? Because it's a big commitment for someone to undertake, and it involves a lot of trust. And so that trust between doctor and patient is huge, and that really becomes the big determination of what you end up doing and how you end up changing teeth. So sometimes it's only 2 veneers and a little bit of whitening that gets the patient to what they want to see. Sometimes it's 20 veneers to get bite changes, to get the functional and aesthetic combination that the patient wants to see. But they're handmade, right? So it's intricate work and it's detailed work. So it takes time to do it right and to do it well. And so, that involves time initial planning. That involves time to get the teeth to do the right thing for the final product, and then time to assess color, shape, small little effects that you're going to put into the tooth to create some more natural effects, that type of thing. But I mean, that's what we have fun doing. because there's nothing more fun than doing that for a patient. And so sometimes it takes a few weeks because everything's just smooth sailing. Sometimes it takes a few months, but the commitment to make sure it's right and to make sure it's the best and ideal, that's what you find with a good cosmetic dentist.
So that's where the artsy side comes out, right?
Yeah, and that's that's the fun part about dentistry is there's some science, there's some psychology, there's communication, there's arts and that type of things, which always makes every day fun coming to the office.
Yeah, we love doing it. It's so fun because, like you said, everyone is unique. Those when you do a veneers case, it's unique to that patient.
Yeah, every single one
Right.
is different.
No two smiles are the same, and so it's fun when you can develop that. And the reveal's fun when they see their teeth for the first time,
Oh yeah.
and it's just like, it just makes me smile every time I think about it.
Yeah.
Still haven't seen it.
Big hugs, sometimes tears, a lot of laughing and smiling real big. There's it's a very rewarding thing to do.
Yeah. So let us know if you have any questions. Comment on the comments below, because a lot of people don't know how veneers work, or how to change smiles, things like that.
Yeah, and we utilize the technology to help patients far and wide. You can reach out and get a free digital consultation through the link on our website, the link on our Instagram page, and through that you can see kind of what's possible for you, because it all just starts with a discussion, conversation of what you want to see.
Good communication.
That's right.